Hey, so here's what I've been thinking. My listeners often tell me that if I want a good show, I have to bring my pain to you. Well, if I'm going to bring my pain, I'm bringing my chiropractor. My name is Vin Dacquino, and today, believe it or not, I am going to introduce you to Lydia Biffer, my chiropractor. Lydia, what a pleasure to have you here.
It's an honor to be here, Vinny.
One might ask, why are you bringing your chiropractor on the show? Let's talk writing. The answer is, you not only cater to writers, but you are an aspiring writer yourself. So today, let's talk about that. Let's talk about who Lydia Biffer is. Let's talk about your advice to writers. And then let's talk about a possible book about chiropractor. So, who are you, Lydia?
Well, I am a practicing chiropractor in Jefferson Valley over 30 years. And I am a native to the area, Mayapack. I grew up. And I've been, under my undergraduate, I went to Boston University.
Wow.
And then, unknowing what I really wanted to do, I was in the sciences, and fortunately, my family met a very prominent and successful chiropractor that I was introduced to and spoke to, and he enlightened me about the field. And I said, okay, I'm going to give it a shot, and I applied. He told me the school that was the finest at that time, and it was called Palmer. It's called Palmer College of Chiropractic, and it was the largest international college in the United States.
Wow.
So it was an incredible experience. I applied, and I attended, and I came back home after graduating, and I worked with another chiropractor for about 3 years, associating with him, and got experience, and then went off and flew off on my own, and here I am today.
So, chiropractic for you is more than a profession. It's more of a passion at this point. Tell me a little bit about that. What does it really mean to you to be a chiropractor?
Well, it's completely invaluable to give someone a quality of their life, to be pain-free, and to do basically all the activities that you want to do in your life. And it's the greatest reward that anyone could ever have because it's totally invaluable.
25 years ago,
Yes.
I was living in what was then relatively new territory, and I had to chop wood. After I split the wood, I had to throw it down to the wood pile. My back got thrown with it. So someone recommended that I see you all those years ago. Within a few weeks, the pain was gone. And yet before that, I was even having trouble breathing because the pain was intense.
Excruciating.
Recently, my back was giving me trouble again. What I found out was I may have a 18-year-old face, but my spine is a lot older. So I came to you.
Yes.
In spasm. Before long, the pain subsided some. I still have some problems. I still see you.
That's called tune-ups.
Yeah.
And that's wellness.
And that tune-up keeps me going.
Yes.
And there are various exercises and things that I have to do to
maintain your health.
Maintain my health. Now, in addition to that, I am a writer. And that means that I spend a lot of hours sitting in front of a computer.
Yes.
And there's do's and don'ts about that.
Yes.
So one of the things that you're here for today is to give advice to some of those writers out there who are doing the wrong thing.
Exactly.
And there is a right thing to writing.
Yes.
When it comes to body. Not necessarily mind, creativity, but the body.
The mechanics.
If you want to be a good writer, you have to respect the body you're in.
Yes.
So tell me a little bit about that.
My pleasure. Well, first of all, when you're sitting at a computer, your computer should be eye level. That's the first thing.
Okay.
And that you should be sitting in a very good, comfortable chair. It could be also ergonomic where they have these little curvatures, but very important that you want a full back. There should not be any opening in the back, and you should be sitting to the back of the chair. So that means if you have arms, those arms should be low enough so that you can get it underneath your desk. So this way you
And
pull
do
it
you
up.
put your elbows on the arms when you're?
You can,
or you just need to be out
depending on
here?
if you have a laptop or your computer. But the best way to do it is if your computer is, for instance, what we just talked about, eye level, that your desk is also that length, but your keyboard should be a little lower because your arm should be about a 45-degree angle.
Oh.
So
okay.
you could get these nice fancy little pads.
So you don't want this, and you don't want this.
Exactly. So then you want your hands to be at about a 45-degree angle. You can get a nice, beautiful pad to actually rest your wrists on. And then also the mouse, they have these beautiful mouses now that have a ball so that it is less stressful on your hand, all right? But it's very important, too, you've got to take breaks. We are not designed to sit there for 8 hours or 10 hours, whatever
See, I
it
do.
is, right? So you've got to take breaks.
So take
and
breaks.
and
Now,
I
when you
suggest
take
that.
these breaks, are there
Yes.
exercises between the breaks? Or
Absolutely.
do you just, is it pure rest?
No, you get up and you move. I like movement.
Yeah, and stretching?
So in stretching out, yes. So I recommend, for instance, you could do things like shrugging your shoulders up and counting to about 3 or 4 and then dropping it down and relaxing. So this way it relaxes your muscles into the back of your neck and also in the upper back. Then you can do some exercises for your neck, which would be, I call this the goose, where you're actually bringing it back. And then you're relaxing, and that releases a lot of the tension. It's a form of traction to your neck. Another way would be also isometrics, where you apply pressure with your hand to your head, and it's resistance from sides to sides, and that will actually strengthen as well as stretch.
I watch people sometimes do that, you know,
Yes,
where
yes,
they
yeah,
do
well,
these
yes,
things. And
right,
do
right.
Now, that's actually good.
Yes, exactly.
Oh, wow.
It's isometrics.
Oh,
yes.
wow, that's good.
Yes.
So isometrics is
Yes.
good for writers.
Exactly. So, you know, this is a picture of a good
okay.
illustration
Let
of
me hold that up.
positioning of yourself to a computer, and that it's eye level, you're sitting to the back of the chair, and your feet should be facing flat on the floor. Very important. So that's one illustration. And then, for more exercises, if you'd like,
Okay. All right, so is that?
and then this is for your hand, especially for writers.
Oh, hands.
So-
I have carpal tunnel
Exactly. So,
because of writing.
so these
and-
are good exercises for you.
Oh, good. And this,
This would be on a flat table, and this way you could stretch out your fingers, extend them out. Another one would be bringing up each finger on a desktop and stretch them out, taking a soft ball and squeezing it so you build up your strength
yeah, I've
again.
seen that. These little rubber balls, the hollow ball.
Yeah, so like foamy, and they're soft
Yeah.
and spongy.
And that's good to do.
Yes.
Now, I know that in my case, with carpal tunnel, what you can't do is close the tunnel.
Exactly.
So what happens is if, as you say, if it's not here
Elevated.
and it's here, the tunnel closes and my
Ouch.
fingers go numb.
Exactly.
So I have to take a break to try to get circulation back
Exactly.
in there. Same thing with driving.
Yes.
When I drive, I have a tendency to put my wrist over the top of the steering wheel. And for me, that's wrong because it closes the tunnel.
Exactly.
And people don't realize that carpal tunnel is exactly that. There is a tunnel that runs through.
Exactly. And the median nerve gets actually impinged. That's what's happening. So the canal gets smaller and impinges that
Now,
median
I
nerve.
also, I've never said this to you, but this may be something that you never even realized. I have particular problems because I'm left-handed. And people say, what does left-handed have anything to do with it? Look, here's how I write. Watch. Look at the tunnel. The tunnel is closed. And what happens is, when I first started writing, I don't want to say how old I am, but when I first started writing, computer wasn't part of this whole thing.
Yes.
So I hand wrote Kiss the Candy Days Goodbye.
Wow.
And page after page after page, and with the closed tunnel.
That's
And
tough.
because of that, it messed up my whole rest. So that made a big difference. Then this electric typewriter came out that was better.
Yes.
Because then I was able to straighten out the tunnel, but same thing, the keyboard is different from on a computer.
right.
And it's stepped. Because
Yes.
it's stepped, that caused me to have to move the wrist a lot.
Yes, of course.
Then we finally got to computers and keyboards. And didn't have computer desks.
Yes.
So I did it at the kitchen table. And then again, wrong
thing.
position. So it evolved, and people didn't realize what it did to their bodies.
Exactly.
As there was an evolution to the computer, there was also an evolution for writers. And fortunately, it's a little healthier now, but people are still bringing laptops everywhere.
Yes.
And not every level surface is designed
Yes.
for writing.
Exactly.
And I sit 6-7 hours sometimes.
Exactly. That's why you've got to take those breaks. Very
Yes,
important.
got to take the breaks, got to
stretch
do the
out.
exercise with the hands
Yes.
in between.
Exactly.
Same thing with the back. I noticed that I get stiff.
Exactly.
I do what many writers do. I sit at the edge of my chair,
Right, which is a no-no.
which is a no-no because now I'm bending. You could
You're
see
straining
my
your
shoulders
back.
are over and straining the back. When I get done, I'm very stiff. That's because I haven't been sitting properly.
Exactly.
So it's important that writers learn that the body does get beat up
Oh, yes.
if you spend too much time in the wrong position. Okay, so now are there exercises to strengthen the body against all of these things?
Yes.
I know there's just things that you teach me
Yes.
when I'm in pain for my back.
Yes.
And some of those relieve instantly, where I can go into a spasm and I can release it with some of the things you've shown me to take the
Right.
pressure off the
Yes.
spine.
Exactly.
Also, it must make a difference when it comes to age. The difference between a 20-year-old writer and an 80-year-old writer. Different things that you have to do. So you recommend that you have to know your body.
Yeah, and you have to listen. Pain is just the tip of the iceberg. So if there is a problem, listen. Don't block that out. Don't ignore it. If there's a problem,
there's
take care of
pain,
it.
then
There's a
something is
problem.
not right.
Exactly. Your body's talking to you. So you've got to take care of it.
You gotta
It's
listen.
it's just like taking care of anything else, whether it's your teeth to maintain things. It's very important. Otherwise, it's going to come down the road as you're getting older. It's going to progress and maybe cause serious problems as you get older. So it's important that you take care of it and nip it right at the time that it
Right.
begins.
So keeping your
Yes.
body active is important.
Very important, yes.
Very
I
important.
recommend that always. I'm very active. I think it's very important to be active, be in motion. I always say the less you do, the worse you feel.
There you go.
So it's
Oh,
very
really?
important. Yeah.
So you need to stay active.
Yes.
And I do notice that. My back started bothering me at the end of the winter. Last summer, I was riding the bike almost every day on the bike trail. I was doing my paddle boat almost every day. And then October came, and that wonderful winter we've had, and I did nothing physically
The worst.
all winter. And I think that's one of the reasons why my back started to act up on me. Mm-hmm. Okay, so what else do you have for us?
So I have TheraBands, what we call TheraBands, which is also an avenue to strengthen and stretch, and these are rubber bands. You
Oh.
can buy these anywhere, and basically it's stretching out and it's resistance. So
Oh,
for instance,
wow.
what I'm doing now here is working on my upper back. Since riders sit a lot, these are very good exercises to strengthen.
And these, do you have to buy like at a medical store or?
You can buy these anywhere.
Anywhere,
in
okay.
in any place. You know,
Yeah.
like
And you use them just as,
a surgical supply place or,
Wow.
you know, yeah.
and they're made out of what, like a rubber?
rubber.
Or-
They're
'cause
rubber.
they look like the caution tapes that police use, but they're not. It's rubber. Wow.
And there are different colors for a different amount of tension. So this is
Oh,
a lighter
wow.
tension, the yellow, but there's red, there's blue. So as you get better and better and you get stronger, then you can go into a stronger strength.
Wow.
But it's really effective, and it's great for upper body, for lower, for your legs.
So it's sort of like karate where you have to earn the black belt, huh? That's cool.
Yes.
Wow. And you just, and then
And it really
I can
does a
feel
great
the
job.
different
Yes.
muscles working
Yes.
differently.
And they have
Wow,
big
that's
rubber
cool.
balls today that
And what are they called?
TheraBands. These are
TheraBands. Okay,
And
cool.
then there's a big ball that's very big, bigger than a beach ball, and you can
Oh,
do
yeah.
stretches.
Yeah,
Have
my
you
wife
seen them?
uses that.
Yes, and those are therapeutic balls, and they're great. And you can work on that and stretch out, and also works with balance. So those are great
So
avenues too.
as opposed to lifting weights.
Exactly.
You don't want, because lifting weights tightens the muscles.
Right,
This
and it
loosens
builds,
them,
but
yes.
I tend to shy away from that because we see a lot of injuries with that.
Yeah.
I believe in that, if you like doing it, but it's very important you know what you're doing and how much, because everybody has limits. And many times people overextend themselves and they keep going and going
Right.
until then we see them when they get injured.
Yeah.
So I
Hello?
prefer this.
Yeah, that's the thing. And you do recommend that when you get injured, don't be a hero, don't be a martyr.
Yes,
That's when you need to go to someone
Yes.
like you and loosen it up and do
Yes.
what you have to do.
Yes.
But there are things, you say,
that
preventative
you can do.
things.
Preventative, yes.
Yeah.
And I tell patients this, if you strain a muscle, for example, that within 5 to 7 days, if it has not improved, then get in. Otherwise, sometimes muscle strains can resolve on their own, and I always tell the patient, put an ice pack on immediately. Go right to ice.
Ice
Ice versus
first,
then
heat
heat.
next.
Yes, always ice.
Yeah, I used to, we have a hot tub.
Yes.
And I used to, if I got injured, I would jump in the hot tub. And that's actually wrong.
Exactly.
It should have been ice and then the hot tub.
Yes.
Okay.
Yes.
How long is there, like, from the injury? I mean, you do ice until it, what, eases
Until
up?
the inflammation settles down. Sometimes,
okay.
like when you came in this last episode, you were in a
Right.
lot of spasm.
Right.
So we never use heat to spasm because heat will actually increase the blood and fluids to the area to increase the spasm. So you want to diminish it, and then as a result of that, you use ice to constrict the blood vessels and fluids. So this way, you will dissipate that spasm.
Wow.
And you'll move better, and you'll feel better.
Now, what
Less
about
pain.
when you're working? Is it good to put an ice pack when you're working or a
When
heat
you're
pad?
inflamed, yes, absolutely. When you're hurting and when you're inflamed, absolutely, sure. It always is helpful.
What about, now, I don't know if you know, more recently, they're making new cars
Yes.
with heat. My wife's car,
Yes.
press a button and there's heat.
Yes.
Is that a good thing?
It is not harmful whatsoever. It's not radiating heat where you're on a hot pack. So
Oh,
it
okay.
is not harmful whatsoever, no. And then, for instance, you're going to be wearing in the winter, when you're putting heat on, it's in the winter, you're wearing
Yeah.
heavy coats and sweaters. It is ineffective that way. It's not going to hurt someone in spasm, no.
Oh, okay. All right. So now let's talk about the other Lydia. The Lydia who not only wants to help writers, but you want people to know what your practice is all about.
Yes.
And you want to, as part of your passion, spread the word.
Yes.
And you want people to know that chiropractic is not witchcraft.
Exactly.
And there was a time
Sure was.
when you were not respected. Tell me a little bit about that.
Well, those are the over 30 years ago when I did practice, and in those years we were considered quacks. And there was a lot of transition in that period because medical doctors did not recognize my profession. If anything, there was always, hush, hush, hush. And I would talk to patients saying, what, as they were healing and getting better, tell your doctor, tell your doctor. And people were afraid to tell their doctor that they were seeing me because they thought they would lose the relationship between doctor and patient. It was very different in those days.
I know when I started to come to you during the early days, and I told my doctor that I was doing it, and he gave the perfect typical answer. Well, he was like, well,
Exactly.
you could.
Yes.
I said, should I go to chiropractor? He said, well, you could. It was like,
Exactly. Well,
Yeah.
I'll tell you, and also I've treated many, many physicians, surgeons, dentists, gynecologists, and in the early years when they would come to me, they would be walking in the back door, not in the front.
Yeah.
And now, no problem.
and insurance wouldn't
Yes.
even cover it.
Exactly. We were not recognized.
No.
But now we are in the mainstream. It is a wonderful time for us. And people are looking for the alternative methods. It's drugless, it's non-surgical, so we're in a very good time. And people are educated today. They're looking for second opinions. It is really a terrific time for this profession.
Okay, so here comes the fun part. People wonder, when you go to the chiropractor, what is this lady going to do to you? And the question is, what does she do while she's in there? Well, we're
first-
ready to show her?
Absolutely. Love to.
All right.
So now what we're going to do is we're going to demonstrate the process. Now, normally we take a full case history.
Okay.
And I examine you. I look at your posture. And then once that's completed and I figure out what is wrong, then we get back on the table. So we're going to get on the table. We're going to
Okay, here we
demonstrate
go.
it nice and easy.
So I go on this side.
Yes.
Oops. I trip over my wire. Then I can go to the chiropractor to get help. Oh, no. Here we go. All right.
And you're going to lay on your stomach.
Lay on my stomach. A lot of stomach to lay on there. Okay.
And we're going to put these blocks underneath your back because I know your back very well.
Yeah,
just like
you
a
do.
book. So we're going to put this underneath. There we go. So now what we're going to do is balance.
We lost the block.
Okay, we're going to get that. Thank you. Perfect. Okay.
All right.
Now what we're going to do is we're going to check your leg lengths.
All right.
And we want to see if your pelvis is intact. So what we see is that you have a short little right leg.
Okay.
And so we're going to start palpating your spine. And this is what we're doing first, is palpating to feel your bones and your muscles to see if things are aligned. And then I want you taking a deep breath and let it out. Very good. Beautiful. Another one. And let it out. Beautiful. Good job. Now what we're going to do is turn on your side and face me here.
Face you. Okay.
Yes.
All right.
You're doing a great job,
Shirt
Benny.
down here.
Yes.
Okay.
Beautiful.
All right. Okay.
Okay. And now we're going to adjust. And this is called manipulation. We call this the $1 million roll.
Oh, there we go.
Yes. And what we're going to do is straighten out your low leg. And what you're going to do is take a deep breath for me.
Ah! No,
And-
just kidding. Just kidding.
Take a deep breath and let it out. Good. Beautiful.
Nice.
Okay, come on up.
Well, all right.
And that's just a little demonstration of what I do.
Oh.
This
Okay.
is very gentle. And then what I want you to do is lay on
Hey,
your
don't
back.
pay attention to her. She kills me in the office. No.
And lay on your back. We're going to show a little demonstration of an exercise.
All right.
All right, for your low back. This
okay.
is one that you love.
This is on my back. Oh yeah, this. Oh, this one has relieved me of pain so many times when I'm in spasm. And when I'm writing for long periods of time, I forget and I get up too quickly from my chair and put my back in a spasm by doing that.
Exactly. So we're going to take
So
your
then
leg,
I do what she's going to show you right now.
and you're going to bring up your leg, your knee to your chest, and hold it there. The count
Yep.
of 3.
I take the pressure off my spine, and believe it or not, I go from spasm to nothing.
Yes. And then you bring up the other one.
I
and
also
alternate it.
sometimes do this standing up,
Exactly.
where I just bring my knees to my chest, and that helps.
Exactly. And then the other one I'd like you to do is bend your legs
Okay?
and lift up your buttock just a little bit right there and squeeze your cheeks. 1,
Okay.
2, 3, and down. And what that does is it actually strengthens your abdomen. Your abdomen supports your back. So that will build that up. And that's the big buzzword today is core muscles. So it's a
Yeah.
big part of, teaching
Right.
people how to strengthen their back. So now you know what to do. Wait.
Oh, no,
roll.
geez.
Roll on your side.
Not let
Fin.
me off the hook
Yep,
that easy.
And come on up. So this way you don't get hurt.
All right.
Okay, good.
Okay.
Okay,
Very good.
good. You did
All
a
right.
great job. The king has done a great job.
Okay. Can't cross wires here. All right. Oh, there we go. We're back.
Wonderful.
Yeah.
You did a great job.
Yeah. I brought you here purposely because there are times when I hurt myself.
Yes.
I sit at the computer. I'm one of those writers who can sit after supper, and my wife used to have to tap me on the shoulder to say it's time for school. And I would be ready for work the next day. I'd be talking 10, 12 hours at a time. And when I'm hot, and I just keep going and going and going and going. Now that does take a toll. It took a
Yes.
toll on my wrist, took a toll on my back. Now at that time, I didn't know about relieving the pressure from my back.
Yes.
But also up in my backbones,
Yes,
my
your
I
torso.
call them my wings,
Yes.
that it got so stiff, and I would have to go in and do things like this, to try to do it.
Right, and stretch out.
Yeah. And when I was younger, it wasn't as bad. The older I get, the harder it is
Yes.
to keep doing something, and pressuring the body.
Yes. Well, that's why it's important that you continue your exercises and keep in motion, because there'll be less strain on you in the long
Right.
term, and then you will feel so much better. I love yoga. I love Pilates.
So
These
all
are
that stuff is good for
It
you.
is. The elliptical is wonderful because there's no force on your knees and your hips. That's a machine that we use to strengthen the back. You could use other machines like a treadmill. You could use, there's so many different devices today
Yeah.
that can help you. A bicycle that has a full
Yeah.
seat.
I was very
You know,
surprised when I
sit on
told
it.
you that I like the paddle boat.
Yes.
I thought you were going to say to me, don't you go near it. And it turns out that the paddle boat in the position that it's in is actually good for me.
Exactly.
And it feels good. This is not good. I've got to get rid of this belly.
Well, you're working on it.
Yeah, I mean, one thing is to wear shirts that cover it, but the other is to actually get rid of it. Watch what you eat. Be
Yes.
careful about your
Yes.
eating. Do plenty of exercise.
Exactly.
So here's a big question. You gonna write a book about this?
Yes, I
Good.
want to expose it. I want people to understand what we do, because we only touch 10 to 15% of the population. I want to get out to the 85% to tell them what
and
we
let
do.
them know what you
Yes.
do. Let them know that chiropractic is a legitimate, important way to help yourself.
Yes.
It sounds good.
Thank you. Thank you.
Any last minute words that you want to share with them
Yes.
that they really should know?
Yes. I really want people to understand, never accept the fact that someone tells you you have to live with pain.
Not
Look
true.
for other
Pain
alternatives.
makes gain.
Right, no.
No.
Look to other alternatives. Chiropractic, acupuncture. There are other methods out there that are wonderful to help you. There are herbs. There are wonderful things that can help to enhance your health.
So, today, ladies and gentlemen, not only have I brought my pain to you, but I brought my cure. This has made a difference in my life. Hopefully, it will make a difference in yours. We want to thank you for coming here today. You've done some good,
Thank you so much for having me. It's such a pleasure to be here with
and
you.
a pleasure to have you.
Thank you.
Thank you for tuning in. Respect your body. Respect your mind, but respect your body. Thank you for tuning in to us today. And as we roll,
Wow, this
We
is
thank you.
exciting.